Hi, I'm Nicole speech language pathologist, professor, and founder of Voice for Possibility. And today I'm going to give a quick lesson on the two different types of feedback that we use in speech therapy. And these types of feedback are based on the principles of motor learning. So they're known as KR and KP feedback. We'll start with KP. KP stands for Knowledge of Performance Feedback. And it's really critical to think about and plan out the type of feedback that you will be using with your client. I mean, this is what we do as speech pathologists, and something over the past couple of months that I've been encouraging the parents of the clients that I work with to think about. So, what is knowledge of performance feedback? This is feedback that is typically used early on in goal attainment. So, if we're teaching the bilabial B or B sound, and maybe the target word is B, we'll have the child say B, or, what animal does bzz? And we'll have them say B. And then we'll say to them, I love the way you put your lips together for that B sound. And that is very specific feedback. We are letting our client know that not only are you getting it right, but you're getting it right because of where you set up your articulator placement. And what we like to do in speech therapy is start with this knowledge of performance feedback, which again is very specific. And then we eventually pare down to a knowledge of results feedback, which would just be, what animal says a bzz sound and the child says B, and then we just say, great job. And we don't say anything else. And the reason why it's critical to really plan this out, obviously we can't always be giving knowledge of performance feedback. We want the child to be able to generalize the skills. And the reality is that they're not going to be walking down the street or engaging in conversation with their friends at school or their parents or what have you, and having a little feedback angel on their shoulder, right? They're going to eventually have to self-identify and be able to, self-correct errored productions, right? So we try to teach this. And I have found that I have also been teaching this concept of feedback to the parents of the clients I treat because they are really at home implementing a lot of the different, targets that I've set up for therapy. So to put it into another framework, I like to talk to my students about, when I learn yoga, when I learn a new yoga pose, and I'm not good at yoga. So when I go in and the yoga teacher is teaching a new pose, what is most beneficial for me in the moment is for her to come up to me and give me knowledge of performance feedback or adjust my body in space because my hips don't go anywhere and I'm so tight, so that I know where I need to go and what that body configuration looks like for that pose, right? So it's crucial for me early on to get that type of feedback. But later on, maybe a couple of weeks later, hopefully, if I'm doing well, all she has to do is give me a look and say, good job, Nicole. And I know that I have put my body in the positioning that is allowing me to be successful with that goal. Again, this is all taken from principles of motor learning, and we know speech is a motor act, and that is why this type of feedback is successful. So I encourage you to think about and plan for the type of feedback that you will be giving your client or your child, and how important that is in shaping speech clarity. So again, we start with knowledge of performance feedback. right? I love the way you put your lips together for that B sound, or I love the way, your lips came out for that vowel, ooh. Such a good job with that. To then later on, great job. You're doing really well, and just pull back. I hope this has been helpful. If you have any questions, you could reach me at nicole@voiceforpossibility.com, or you could just reply to this video that I will be posting. And if you have any other topics you would like me to discuss, I would love to hear from you also. Take care, everybody.